Hello, everyone, and thank you so much for the opportunity to present here at AIOS. I apologize for my absence, physical absence there, but I wish to make it up through this video seminar on patient engagement strategies for myopia management. Now, this is a slightly different IC where we focus on different aspects of myopia management and especially the practice oriented aspects. I will be talking about why we need to engage patients. First, let's answer the question, what does patient engagement actually mean? It primarily is a patient centric approach. Now, we are all used to the kind of approach wherein the doctor has his point of view and his recommendations, and the optometrist and the entire team works towards in that goal. However, when we slightly change our perspective towards a patient's point of view and a patient centric approach, we can actually change a lot in our practice flow, which can engage the patients in a much better manner and create much happier patients and much better outcomes. So, as I was saying, why do we need to do patient engagement strategies? One is to improve health outcomes. Patients who understand better and who are a part of an efficient process actually have better health outcomes. The second is enhanced patient satisfaction. Now, patients who have a much easier process to go through to come for such a chronic and long term disease ensure that they are satisfied and they give you positive reviews. The third is there is a significant reduction in indirect healthcare costs when incurred by the patient, as well as flow based costs incurred by the system itself. So, there you go. That's why we need to engage patients in a more healthier manner. Let me go through the my practical aspects of what I do in my clinic and where 5 areas where I engage patients, and maybe through this we can have an interesting discussion going on. So the first and the foremost is in the clinic. The most important in the clinic is to have an efficient system. So we need to make sure our protocols for work flow are optimized, and I think Dr. Jetani will be talking about that, so that an entire myopia workup and from in to out time is reduced to probably an hour or less. And the second thing is training. I train my optometrist to counsel about myopia strategies, to talk about myopia lifestyle modifications right when they start seeing. So there are two important people in my clinic. One is the optometrist, and the second is the counselor, the person who finally they see. These two people have a ready-made script which they actually follow to see whether a checklist is done, whether they have spoken about all these things, and whether they have also imparted the knowledge of other possible options to the patient as well. The third is the questionnaire. Now, this is something that has worked well for me. That is, whenever we do this myopia workup, it takes a considerable amount of time. And during that time, to engage the parents, I give them a questionnaire which is through a Google link. Now, this questionnaire is about a 30-point questionnaire, which takes about roughly 10 to 15 minutes for the parents to fill. And some parents are quite engaged with filling that while the workup is being done. So, this is an interesting way to engage parents while while the children is getting checked. The fourth is to ensure the room has enough amount of infographics and videos. And in terms of flow, what I recommend to my patient is when a first patient comes and gets diagnosed as a new myopia, I always keep my days of myopia clinic on Fridays and on a different clinic on Mondays and Tuesdays. So 3 days a week I run my myopia clinic, and any other patient who comes on any other day gets checked, but they are always sent an appointment for those 3 myopia clinic days. Now, the advantage of having to come back for those days is, one, they are monetarily prepared to have the myopia workup done. Two, they are mentally prepared to spend some time in the clinic rather than being hassled for time in their original visit itself. And the third is that day there are enough number of myopia patients, so actually giving them information is much easier. So I always fix an appointment on another day for the myopia clinic. Of course, my follow-up patients always know the dates of the myopia clinic and come on those days. So this is how a myopia clinic looks, and you can see that this is how the mascot that we have designed. So here you can see this is how the refraction room is. This is a separate refraction room. This is my optometrist explaining the situation here. We have a separate logo and branding for the myopia clinic, and our mascot is there quite visibly everywhere for the patients to kind of see what's happening in the myopia clinic. I also have comic books scattered across in the clinic so that the patients can read and get more awareness about myopia and spectacles per se. Now, this center, what you see is the workflow pattern that I actually follow in my clinic. So you can see that this pro forma is printed out across all all my centers, and they all have to follow this checklist. And towards the end, you can see that questionnaire tick if done, WhatsApp group support tick if done, graph, and that's the myopia journal that we give our patients, tick if done. Now this is a proper checklist that the optometrist actually goes through and fills it up so that they know that everything is done for that patient. And these are the kind of explicit information that's available at all points in the clinics, and this is something that I have inside my clinic, inside my doctor's consultation room, that actually patients and the parents can read while I get their child checked up. Now, while they are in the doctor's room, I spend a lot of time listening to the patient to make aware of their choices. And sometimes it may be seeming that they may not understand scientifically, but believe me, if we explain scientific terms in a really simple manner, patients do accept, and their acceptance to higher myopia strategies actually take up quite well. The second and most important thing is to have shared decision making. Now, this is something very important, and I think Dr. Aloka may be touching on that. It's important for the parent to be a partner in your journey for myopia, and I always do not say that this has to be done. I always give them two choices. Of course, I always tell them I recommend this choice, but it's up to you to take the other choice. That's your choice as well. I tell them the pros and the cons, and the decision is finally taken by the parent, and that's extremely important because then they become responsible for that journey's process as well. The third is to have a personalized approach. Now, how I do this is, once we decide that okay, the myopia is progressing and we need to do something about it, I tell them about these strategies, and I tell them, you have this choice. You have the orthokeratology, you have the spectacle lenses or the low dose atropine. I tell them about the pros and cons, and I tell them for her or for him, this may be the ideal choice, and I explain why that may be an ideal choice. I also go through the Google form in the clinic in front of the patient as the patient is sitting there, the Google form that the parent has filled in during the waiting time. Now that helps me kind of see what their lifestyle is and quickly make decisions based on that and give them a personalized approach. Like I ask them, listen, you have classes till 4:30. Now what are you doing from 4:30 to 5:30? Just add a sport there. Where do you live? Do you live close by to a sports arena? Then you go to visit a sports arena. Some children say they like the morning. So I tell them morning, go for one round of sport activity, then go to school. So you kind of personalize it right then and there in the clinic based on the Google form. The fourth is gamification of goals, which means that when they come back and they have reached their goal or they have spent that much of time, I always reward them with something small like stickers or some little things that don't actually matter much to us, but it matters a lot to them. So just to show an example of that, you can see that this is how we have the lenses in the clinic that can actually, the patients can see. I do show them about each strategy, like myopia, there is a orthokeratology session, this is how it looks. I do have my trial set right in the clinic, so I show them this is the orthokeratology trial set, this is the EDOF trial set. So you can visually, they see what's there and then they get to make more informed choice. And of course, this is about the shared decision making. So you can see there are different levels of how a parent would react, but I always ask them to be a part of the healthcare team and also to have be their own health advocate. The child has to be responsible for their own health behaviors. So why this helps is because they do not complain if a strategy doesn't work. Like if something as expensive as spectacles or orthokeratology doesn't seem to be controlling, they know and they take responsibility because they know it's a disease that involves lifestyle plus all our genetic and our whatever strategy that we're using. So upon leaving the hospital, the most important is I give them a myopia journal, which I will be showing you. I ask them for a good Google review. I would ask them what channel they like to be updated. Is it SMS, WhatsApp, email? And then as per that, I kind of fit them into that group. And I also send them regular protocol and reminders. I also ask them which school they go to, because sometimes you can get a link from the school and we can visit the school for school screening program. Now this is the myopia journal that we see. You can see this child has been following up consistently from 22 to 24. This is how the journal looks, and this is the kind of gamification that we do. We give little stickers, we start them on little things, and then this is a sticker box that I have that helps them kind of gives them a little bit of boost. I also add them to the myopia support group. This is the Google questionnaire I was talking about, and for better workflow optimization, I give them a myopia, we have a myopia clinic website, email ID, where we have this kind of a Google sheet where everyone fills in what are the number of advice and orders done, and then they also have this kind of a follow-up, and we make sure that a Google Calendar is linked to the date that they have reviewed, so that their next review pops up on our screen for the optometrist or the counselor to make phone calls and remind them every 6 months to come for their review. We also give them recall engagements like events, appreciation, Q&A sessions. This is the recent one we conducted, which is a selfie with sun contest, and we gave out certificates of appreciation. These are the kind of pictures that these children sent out to us. It's really interesting. The children, once they are engaged and they know what is good for them, they really get into the flow. This is one such event where we had this kind of a get together of children with myopia, and we had these kind of interesting activities. It's also important to have some key metrics in our clinic, like patient appointment times, whether we are having good appointments follow up, whether there are no shows, how many appointments are there, what is the wait time. These are feedbacks that we need to keep going back to improve the efficiency of our system. So there you go. This is the last slide. This effective patient engagement strategies involve the pre-visit, during visit, post-visit, and ongoing. So pre-visit, good information, appointment reminders. During visit, listen actively, involve in shared decision making, and set goals for the patient. Post-visit, have a timely follow-up with reminders, and as an ongoing, keep getting patient feedback, and include the use of technology and automation to make all of this process much easier. So thank you so much for your patient listening. I know that systems and processes are essential to keep the crusade going, but we should never forget that the crusade is the most important. Thank you so much. You can contact me on this email address and phone number. And thank you once again for this opportunity at AIOS.
I think Dr. Shruti has extensively covered the entire patient engagement strategies, and her tips in her own hospital look very exciting, which we can take back